In studio, I have Dr. Kireki. He's a consultant OB/GYN. Thank you so much for being here. Let me start by asking you this question. What is endometriosis and what causes it?
Thank you very much for inviting me to the studio. Endometriosis basically touches on most young women. About 20, almost 30% of the women who have infertility issues have a problem with endometriosis. Now, what is endometriosis? Normally, when a lady has her periods, what comes out is what we call the lining of the womb. Sometimes that lining can actually find itself outside the womb. It can be on the tubes, on the fallopian tubes. It can be on the ovaries. It can sometimes be in the muscle of the womb, what we call adenomyosis. It can find itself actually in other places completely different, for instance, in the bowels, in the large intestine. It can go even to the bladder. So when we get a bit of the lining of the womb being in a place which is called an ectopic place, outside where it normally is supposed to be, we call that endometriosis.
So what are its symptoms?
Symptoms vary, but one of the most common symptoms is that the patients have pain. Sometimes it's excruciating pain, pain which starts a few days to about a week before the period starts. And then once the period starts, actually that pain sort of clears away and there is no pain afterwards. And then the interesting thing is that this pain is cyclical. So every month, just before the period, there is pain. Horrible pain, which disappears after the period. The next question we ask is, when does it start? And does it disappear? Possibly could be endometriosis. And then the other thing is that most of these patients who come, they come because they're trying to have a baby. So there is infertility connected with endometriosis. The other symptoms can actually be low abdominal pain, horrible. We talked about that horrible pain. There can be nausea. Some patients can actually have vomiting. They can have issues with when they're going to the long call. They can have some blood on the stool. They can have issues when they go for a short call. They can have issues when they're having intercourse as well. And some of these problems can actually lead even to depression. It leads to low self-esteem and so on and so forth.
And how is it diagnosed?
When we see a patient whom we suspect that she could be having endometriosis, the first thing is take a history. A good, proper medical history. When was her first period? When was her last period? How are the periods? The characteristics of the period? Are they heavy? Is there pain? What kind of pain it is? And so on and so forth. And then the other things come on, whether she's whether she's had children, how many children, if she's trying to have a child, and so on and so forth. Now, once we have that out of the way, as I said, the first signal is the pain, which is cyclical. So the next thing we want to do is there are two ways of actually diagnosing and making sure that this is endometriosis. The first one, which all of us should be able to do, or most of the specialists, is basically to take that patient to theater and do what is called a diagnostic laparoscopy. Now, what does that mean? It basically means that we make a small incision where we have the belly button and we put a camera inside the abdomen, and we see what is happening in the abdomen on a screen. And you can actually see spots of endometriosis most of the time. You can actually see whether you have a cyst, which is endometriotic, meaning it has old blood in it. Sometimes you may find the organs are actually all stuck together. So that is a definitive diagnosis. And then we are actually required to take a little bit of tissue to send it for diagnosis. Now, in the event that you may be in a place whereby you may not have access to this equipment where we can take a patient to theater and do a diagnostic laparoscopy, you can do what is implied diagnosis. What does that mean? Basically means that we can give the patient some medications which she uses on a daily basis for at least 3 months.
Okay.
If during that period the pain reduces or disappears completely, then you can have an indirect diagnosis of endometriosis. Because I know there are some places where A, you may not have enough specialists, B, you may not have the equipment, or C, you may have the equipment, you don't have the personnel who are actually skilled and have the ability to do this diagnosis laparoscopically.
Are there conditions commonly confused with endometriosis?
Yes. especially in young girls. So painful periods which start early may be confused with something else, or they may just actually be underestimated. And by the time a definitive diagnosis has been made, it is quite late. There is something what we call premenstrual syndrome, whereby these patients, because of the differences in hormones in the cycle, you find that they have a lot of pain, they can even have nausea and vomiting, and then the periods come which are painful. So you have 3 to 5 days whereby they are completely cannot do anything. Okay. So this actually can also be confused with endometriosis.
What about fertility? What is the impact of this on fertility?
Huge impact, unfortunately, very huge impact. Because as I said, you may find a bit of this tissue which is actually active under the hormones during the cycle. Mm-hmm. If it happens to land on the tubes, it actually distorts that tube, or those tubes for that matter. So those tubes may not be working normally the way they do, because normally in a cycle, around ovulation time, these tubes are actually supposed to make, such kind of movement, what we call peristaltic movement. And in that movement, they actually carry the egg or the fertilized egg, which is the embryo, into the womb. Now, if they have endometriosis, which is active on these tubes, they actually don't do those movements. Okay. So what happens is that embryo can actually, number one, implant in the tube, and then you have what is called an ectopic pregnancy. That is A. B, if the endometriosis is extensive, these tubes will not be functional at all. Mm-hmm. There is also something we call the immune system. There's an element of the immune system whereby in patients who have extensive endometriosis, the immune system takes over, and then basically these patients may not actually be able to get pregnant at all, because normally it can be a problem getting pregnant. But now the interesting thing is that once you have got pregnant, pregnancy actually suppresses the hormones which actually can lead to activity of endometriosis. Mm-hmm. So normally it is not a problem. The problem sometimes can be in getting pregnant. Mm-hmm. But once you've got pregnant, the body accepts the baby, because baby is a foreign body, as it were. Once it has accepted that, the hormones that are produced by the pregnancy suppress the ovaries, and the ovaries are not working the way they normally should, and therefore the endometriosis will not be active, so it should not affect the pregnancy. 2
quick last questions, very brief, Dr. What is sex like if you have endometriosis?
Very good question. Unfortunately, especially if the endometriosis is extensive, sex is horrible. It's horribly painful. So in that case, women may want actually to avoid having intercourse, because when they think about that pain, you have a psychological block. Sometimes that pain is not alleviated even by using medications. So you find you start avoiding having intercourse, because that pain, especially during deep penetration, is very painful. So you don't want to go down that road, so you want to avoid it. This can lead to problems later on in the family. I mean, sex is part of marriage life. Yeah. So if it is not there, then definitely it's going to be a problem.
And finally, what are the treatment options?
Treatment options are many. Number one, once we have made the diagnosis, definitive diagnosis that we have endometriosis, we can remove it. If it is very mild, we can use some medications which can actually stop the ovaries from working for some time. We can use some injections. The medication I said, there are tablets which we can use, oral contraceptive pills. We can use what is called progestins. We can use what is called GnRH analogs, medications which actually block the brain from connecting, with the ovaries. Unfortunately, because of that blockage, you find that the female hormones are not being produced. So we're actually inducing what is called chemical menopause, with the side effects which come with it. You may have hot flashes, palpitations, sometimes memory loss, sometimes you have issues with sleeping, and so on and so forth. Okay. So that one, we do that. We use these medications, especially when it's extensive endometriosis. The other medications which we can use to actually sort of complement what we're using is painkillers. If it's very mild endometriosis, endometriosis, which does not need aggressive treatment, the first line of treatment is to use painkillers and see whether they'll help. If they don't, then we have all these, you know, we have a wide panoply of medications which we can use.
Okay. Thank you so much, Dr. for coming
You're
into
welcome.
studio.
Thank you very much.
We will take a short break, and don't forget to tweet us at K24TV, on Facebook at K24TV.